Welcome back to the TV studio here at UEG Week 2022. My name is Jonathan McRae, and in this session we'll be exploring the work of the UEG Research Committee. So it makes sense, I suppose, that I'm joined by Luigi Ricciardiello, the chair of the UEG Research Committee, Neil Henderson, our UEG Research Prize Winner, Chloé Melchior, who is the UEG Research Fellow 2020, and Matilda Oliver, who is a UEG Research Policy Manager. You're all very welcome. Looking forward to digging deeper into the research work that has been done. Let's start off talking about the White Book because it's quite a provocative name, Big Burden, Low Funding. Tell me about this White Book too and why you thought it was important to be commissioned.
Well, thank you for the question. I think it is an important part of the research committee activity. So UEG had a first White Book in 2014, providing the information about the burden of digestive diseases across Europe. So in 2018, we decided it was about time to review and renew the data. And so the activity that has been done has been focused on the burden of digestive disease, the economical impact, but also to understand whether there were research gaps and whether we could fill the research gaps and whether the research gaps were due to lack of funding from the European bodies that are financing research.
Matilda, what was the process here? How did you go about assembling the White Book?
Yeah, so we had some discussions within the UEG Council, with the UEG Research Committee also on what do we wanted to have as a project. Luigi explained a little bit about that. Then we had a call for proposal. We had very interesting proposal, and we decided to select the University of Liverpool, led by a team of researchers, Benjamin Barr and Tanis Rose, who are focusing on public health. And yeah, they started the project in October 2020, so 2 years ago now, until July 2022. So now they finished the project, and we are very happy with it.
Yeah, so the project is finished and the dissemination phase begins. There are 3 work packages. Talk me through those and give us some detail, please.
So the first work package is on the disease burden across Europe. The second work package is related to the economic impact, and the third work package is on the research gaps. And so the first 2 work package make like the first part of the White Book. And the interesting data that we have obtained is that, as we know, digestive diseases are a big burden across Europe. They are affecting 300 million people in the European continent. And also, there has been an increase in several diseases over the years. The time frame was 2000-2019. In particular, pancreatitis, esophageal reflux disease, the celiac disease in the pediatric population. Another important point is that we see a jump in digestive cancer. Digestive cancers make about 30% of all cancers in Europe, and in particular, pancreatic cancer, liver cancer has seen the highest jump.
Were you surprised by that? Because you probably had a sense on the ground, but seeing the data come back?
Well, I was surprised by the magnitude, actually. Yeah. We knew that these cancers were increasing over the years, but they are definitely impacting the mortality of our population, and this is something that needs to be taken care of.
One of the things that you were trying to do is try and figure out what the economic costs are for digestive diseases in Europe. That's a big, broad banner, but do you have an idea of what the bill looks like?
Well, it is quite substantial. Actually, the digestive disease make up to 89 billion euros on the European soil.
Wow.
And the interesting thing is that if we would, reduce the premature mortality of digestive diseases by 25% across Europe, we would be saving approximately 12 billion euros, which is a huge amount of money. And I think this is something that the politicians want to hear from us. We need to really bring all these figures, mortality and the economic impact, just to make them understanding that this is really an important issue.
Yeah. one of UEG's priorities is more public research funding should be allocated to digestive health. It's one of the reasons why this book was commissioned. That's why you wanted to have a special focus in this issue in the survey, right?
Yes, indeed. So the analysis, it's the part 2 of the white book, and it's analyzing basically 3 main things. First, it was a survey towards the UEG national societies. Second, bibliometric analysis. And third, an analysis of the Horizon 2020 funding. So Horizon 2020 is this big European program funded by the European Union. So in general, the results are that most of the digestive diseases are underfunded. Compared to the burden of the diseases, but also compared to other non-digestive diseases. And another striking fact is that, especially for some diseases, for like inflammatory bowel syndrome, pancreatitis, alcohol-related liver disease, we see that that these are diseases that were very underfunded in Horizon 2020, and that were also earmarked as priorities by the UEG national societies.
Yeah, I suppose whatever the disease area, most people working in that area probably feel that their research is underfunded. But compared to the burden, which is what the main metric we're seeing, that these things are underfunded.
And yeah, indeed, and I think that's really some priorities that we will have to focus on in the next years with the research committee, with the public affairs committee, focusing on these diseases so that they receive more funding at the European level.
Neil, congratulations again on the Research Prize. It was lovely to see you yesterday. Can you tell me a little bit about research funding in your specific field? How well funded is your area of research?
Yeah, I mean, I think in the UK, we are very fortunate in that we have the Wellcome Trust, which is a huge fund. And we're very lucky to have that in addition to Medical Research Council funding. But, you know, as my colleagues were saying, liver disease is underfunded research-wise for sure. It's a huge burden. It's getting more common. The mortality is rising. It's not going down, unlike many of the big diseases. So we need to do more, and we need to be even more proactive. There are some liver charities that do great work raising money, but when you compare us, for example, in the UK to the British Heart Foundation, we have a lot of work to do. There's a big disparity there. And there are many drivers for that. You know, liver disease, dare I say, at times is just deemed less charity giving than, say, heart disease. And we need to think about why the public perceives it that way. So, yeah, we need to think more about this.
Is there a sense that perhaps liver disease is less worthy because it's more that it's perceived as being more lifestyle oriented?
Yeah, I think that's a very good point you make, and again, it's, you know, it's educating the public that there is huge amounts of liver disease that are not alcohol induced. Fatty liver disease, you know, we need to just remove stigma from that and take the lazy approach of saying, well, people should lose weight. We can't think like that. If you look at our clinics for fatty liver disease, less than 5% of patients actually are able to achieve sustained weight loss. So it's a huge epidemic. It's a massive health problem, and you know, we need to work hard in that area because we're going to reap the whirlwind in the next 30 years of liver disease at this rate because obesity is so high. So you're getting into societal issues there where, you know, we need to get the nation to lose weight and significantly lose weight.
Chloé, what about your area of research? What do you specialize in, and how well funded is it?
Yeah, so I'm specialized in neurogastroenterology and mostly IBS, and as we talk, it's a really underfunded specialty. So I think one problem is there is a lack of interest from industries that can fund in the grants. So we can apply to general grant, but there is no specific grant in neurogastroenterology. So or you will fight against endoscopy, IBD, oncology, or it will be like with other diseases such as heart disease or anyway. And for example, when I wanted to move abroad, I looked to all the possibility to be funded, and I could only apply to the French Gastroenterology National Society or to the UEG, but all the others were specific for endoscopy or for oncology. So I didn't get many choice at this time point, for example.
Right, so again, a lack of funding in that area. What struck you most from the White Book 2 results? What was the figure that really surprised you, Luigi?
Several things, actually. First of all, is that the digestive diseases are a big burden, especially in Eastern Europe. There are disparities across the continent. There are disparities within the country, and I think this has to do with the, inequality within, the population. And then, of course, there are important issues that are, in my opinion, the next step work that we need to do with our policymakers. Lifestyle factors are really a big factor, big contributors to several diseases. There is a really lack in, preventive medicine efforts. If you think about obesity, is really a big risk factor for many of the digestive diseases, including cancer. There's nothing literally done on, alcohol-driven diseases. We already know that alcohol is a big contributor, but there is very little information on how literally alcohol is contributing to, liver disease or to cancer, and we know that alcohol is a factor. So these are the things that we need to bring forward, and there are many, many other aspects that you can dig into, the White Book, and you will be finding very interesting.
Mathilde?
Also, the economic costs were an important topic. We see that all over Europe, there is only a few countries that actually have data on the economic burden of digestive diseases. And that's really something on which we need to work and inform the policymakers throughout Europe about this. We need the data on economic costs.
What would you say to policymakers based on the White Book?
I would focus on cancer screening. Like Luigi was mentioning, the East-West divide in digestive disease is very prominent. One aspect of it is that cancer screening programs are very differently implemented from one country to another. So that's something that we focus on at UEG level. We have been working on several position papers. I know that Luigi have been part of several of them, so that we try to advocate toward the European Commission our positions. Especially right now, there is an update of the European recommendations on cancer screening, especially on CRC, on liver, and on gastric cancer, and that's really an area where we need to focus on.
Another important task of the UEG Research Committee is to award the Research Prize, and we're delighted to have Neil Henderson, this year's winner, with us. Matilda, maybe you might give us a few words of introduction about the Research Prize. Why is it chosen? Why is it important?
Yes, the UEG Research Prize is the biggest prize that UEG gives. It's 100,000 euros that we give to an active researcher at the age of their career. We really want to award this to an excellent researcher leading an important research team. So yeah, we try to support a future research project from the early stage to the successful conclusion of the project.
Yeah. Neil, tell us a little bit about you and when you found out that you had won. What does it mean to win the Research Prize?
Yeah, it's a huge honour. I was absolutely delighted. Across Europe, there are many, many excellent research groups, so I was delighted to receive the prize, and it's really facilitatory in lots of different ways. I'd say the two main ways are it allows me to open up our collaborator network even more via the UEG, and during this meeting, there's a number of people come up to me after we talked yesterday and set up new collaborations already, so it's almost...
After they found out you'd been given 100,000 euro.
Yes,
what a coincidence.
It's a way to make friends. That was it actually in real time. And then, secondly and importantly, it allows us to do single cell sequencing of all these liver samples and really drive forward our research. So, yeah, it's, as I say, absolutely delighted to receive it.
Yeah, I really enjoyed Neil's session, which you can watch back on the platform until November 17th. So what are you planning on doing? Do you have specific plans to do with that, of what you're going to do with that money already?
Yeah, we do. So my feeling is that one of the big questions that we have as a liver community is We know quite a lot now about the end stage of, for example, fatty liver disease, but what we need to know more about is the progression of the disease, because that's where we're going to treat patients. So one of the key questions that we'll use this funding for is to elucidate whether the targets change earlier in the disease course. And this will allow us to really zero in on that and get into precision medicine in that setting.
Brilliant. Matilda, can you remind the audience how they can apply for the Research Prize and what the criteria are?
Yeah, so for the Research Prize 2023, the application is already open now. It will be open until April 17. I said in general what kind of a profile do we look for. One formal criteria that we have is that you need to be a co-author in one of the abstracts submitted to UEG Week in the past 3 years. So for 2023, it will be 2020, 2021, or 2022.
Right. Okay, so they need to have been a co-author on an abstract, already working in that area. Okay. Luigi, UEG also awards the Research Fellowship. Tell me a little bit about that and why that's an important prize.
So the Research Fellowship is very important. We want to support the young researchers in their early phase of the career. They can be either basic scientists or clinical scientists. The idea is to match with a very well-established PI across Europe and then set up a research program that will allow, the growth of the researcher in the specific field and to become, an independent researcher. So we are giving 50,000 euros. The requirements are that the researcher has to be in the early phase of the career, just out of, the PhD program by no more than 5 years, or the specialty. And then, of course, we judge on the quality of the PI, the quality of the program, and the little research track that the researcher is providing.
So, Chloé, for you, this meant moving house, did it?
Yeah, so I got it in 2020 and I moved to Gothenburg in Sweden, and that was an amazing experience.
So tell me a little bit about Gothenburg and how this fellowship helped you grow.
So I think it was really stimulating to be in such a well-known center. I improved a lot my skill, but also my network. And I had the chance to have a great supervisor, Magnus Simran, so I really enjoy it, and I'm still working in contact with them in different projects.
Tell me about your research project. What is it about?
It was about a new gas sensing capsule to understand the mechanism of the fructan in IBS patient and the link with microbiota. So it's still ongoing because we haven't yet finished to include all the patients, but I shared this project with a PhD student just at Gerard, which is still working on it now that I'm going back to Rome.
Fantastic. So since getting the fellowship, you have started to take up some tasks within UEG, I think. Can you tell us a little bit about those?
Yeah, I think the most important task I've been in is to be a UEG Journal Editor, so the trainee editor. That was also a task that helped me to improve, to see how you can improve a journal, but also how you can improve the visibility of your own research. So it was a great experience as well.
You got some insider tips on how to get published.
you can see it in that way.
Tell me a little bit more about how our audience at home or however they're watching, how they can get more involved in UEG.
I think the best is to look on the UEG website, which is really good, and there are lots of application possibility depending on what your interests are. It could be in research, it could be in the young community, and I think there are lots of really amazing experience where you can have network, and I think you should just apply and don't ask too much questions. If you feel the criteria or not, you will see, and it will be very interesting experience.
You said your research project is still continuing. Does that mean you're still in Gothenburg, or have you gone back to Rouen? And has it fostered a relationship between the two institutions?
Yeah, so now I'm back to Rouen since 3 months now. But yeah, we are still ongoing project that we are working together on. But we also work on new projects, and I also start to include patients in an international study led by Leuven, but who was also take place in Gothenburg. So I see how it was working in Gothenburg, and then it took place now also in my center. So
it sounds like a fantastic program. Luigi, can you remind people at home how to apply for it?
So they can apply, they can go on the website and then they can apply by April 17, like for the research prize. And again, if you look carefully at the specific, requirements that we are seeking, I think you will find all the information there.
Yep.
Again, being out of the PhD program by no more than 5 years and being a specialist by no more than 5 years, I think is very important.
So you're very busy in the research office. You're also working to develop participation of UEG research on projects like Horizon 20, well, it was 2020, it's not 2020 anymore, the Horizon Europe program. Yeah. Tell us a little bit about that.
So UEG for several years, supported consortia with a 10,000 euro grant just to connect. And the 10,000 euros were meant to have the consortia meeting either at the House of European Gastroenterology, but facilitating really the networking and the building up of the project. But several people felt that UEG should be more involved in the research programs. And it's a big step forward, having UEG becoming a partner of a European project, and that is what we are launching now. It's already on the website. UEG will be participating actively as a partner, first disseminating partner, then we are thinking to step forward, becoming a work package leader, and then in the end, to coordinate a European project. I think this is very important because other societies across Europe, the cardiology societies, for example, they have been really active and coordinating and participating in European programs. So it's about time that UEG starts that.
Matilda, can you tell me a little bit more about the process to partner up with UEG for some of the funding like this?
Yeah, so we have a specific page on the website. So project coordinator should contact the UEG office and actually myself within 8 weeks for first stage one stage proposal, and within 4 weeks for 2-stage proposals. And UEG commits to answer within 2 weeks. This will be reviewed by a group of researchers from the research committee. And that's a very simple process. They should send us a 2-page document summarizing the main information about the project partners, also why do they want UEG to be part of these proposals, and how this aligns with the UEG strategic priorities.
Yeah, I mean, it is a lot of work, but the benefits are huge. And I'm reminded of that phrase, how do you eat an elephant, which is one spoon at a time. Luigi, for 4 years as a research committee chair, you're coming to an end at the end of this year. You've achieved so much, but what words do you have for your successor, Silvio Danese?
Well, first of all, I need to thank all the people who have contributed, because the research committee, Matilda in particular, were a key part of the whole process. Well, I think Silvio is the right person. He's a researcher. He believes in research, and he has a strong track. And I think fostering research, supporting young researchers, supporting networking will be key in the future, as we have already started doing in the past 4 years. I think the work with the White Book and partnering with the Public Affairs Committee is going to be critical in achieving future goals from the UEG side. And so I think it's something that there are several things that will be set up by Silvio in the future will make research a priority for UEG, and he will be successful. I truly believe that.
Any final thoughts for our audience watching at home, Luigi, thinking about these prizes and these opportunities to grow their funding?
Yeah. UEG is providing a lot of support for your research in terms of financial support, networking. Take a look at the White Book. That is very important, because this is not only applying to Europe, it's also data that is countrywide. And so you have to really take a deep look, and we will be supporting you whether you you need to have more information about the data that is out there.
Well, thank you so much to our faculty. I really appreciate you joining us and telling us about your research and the funding opportunities. If you would like to access the White Book, that as well as Mistakes in 2022 and lots of other materials are available in the My Briefcase section of the website. You can also find the White Book on the UEG website. We will be back in the TV studio for 2:30 for UEG Week Digested. And if you're bored at lunchtime, why not explore the virtual platform and take part in the treasure hunt where you can win some fantastic prizes by just exploring the various areas, looking at the poster sessions and the industry areas. Enjoy the rest of the afternoon if you're not joining us at 2:30. And of course, if you've missed a session, check it out in the on-demand section. They'll be there until November 17th. That's it from us for now. We'll see you in a few minutes. Thanks, guys.